We will be on location at Advanced Hearing Healthcare in Lorton and Arlington, Virginia, discussing advances in hearing care and how they can help restore your hearing and regain the quality of your life with two of this region's top audiologists, Dr. Maria Sakellarides and Dr. Scott Lanford. Dr. Maria received her doctorate degree in audiology from the University of Florida, and Dr. Scott received his doctorate in audiology from the University of North Texas, and they are both widely regarded as some of this area's leading audiologists. Welcome, Dr. Maria. It's a pleasure having you on our program.
Thank you.
We've got a lot to talk about today. We've got yourself, we've got Dr. Scott joining us a bit later, not to mention a few patients talking about their experiences. But I wanted to begin, Dr. Maria, by basically asking you regarding the advances that have taken place in hearing aids and hearing care recently. And I wanted to ask if you can please tell us what some of these advances are and how we can benefit from them.
I love advanced technology. And I'm very excited to say that we have hearing aids that are actually in communication with each other now. There are computer chips that are very, very fast and in their processing of sound. We are able now to connect into electronic devices. And thus, the connectivity between hearing aids and everything else, we're able to hear better in background noise listening situations. We're able to focus on localization of where the sound is coming from. We're able to connect into closed loop systems where they're in places of worship, in places of bus tours, for instance, so people can actually connect now with their hearing aids. And I think one of the most recent technological advances is personalization of sound, sound quality, and that's been only within the past few months, actually, because we can actually personalize how the patient actually wants to hear, whether it's a fullness or roundness to the sound, or whether it's a sharp and distinct sound.
Very interesting. So all made possible through, as you just said a few moments ago, advances in technology.
That's correct.
Now, what type of hearing problems do these hearing aids address or can correct?
I believe that hearing aids can address most hearing problems. 90% of the patients that come through our door can be helped with amplification. The other 10% may be a medical issue of some kind. So mostly all hearing loss.
Now, how would someone know if they're suffering from hearing loss?
That's a very good question. Most of the people that come into our office do not recognize that they have hearing loss. Hearing loss is a very invisible type of communication. One of the things we tell people is to listen to their family and their friends and what they say, because that will give the first instance that they're actually having a problem with their hearing. One of the things could be that they hear but they don't understand, or people are mumbling, or they're turning up the television louder than normal. Or they just don't like to go into social situations anymore. So a lot of these factors are involved with hearing loss, and a lot of people may be depressed, there may be anxiety, there may be frustration in their life, and not even realize that they're actually having a hearing problem.
My goodness. And what would you say, Dr. Maria, are some of the most common causes of the hearing loss?
One of the most common causes of hearing loss is actually noise-induced hearing loss, and that has been researched by NIH. So noise-induced hearing loss, a lot of our baby boomers that are coming into the picture now have had iPods or iPads that have really destroyed their hearing in the long term. And military noise exposure, firearms, etc., all of those kinds of things. The second most common would be the aging process.
So as one goes through life and gets older, as you just touched on here with the second major cause, there is an inevitable amount of hearing loss that we suffer from.
Yes.
And once it gets to the point where you just said it distracts us, we can't understand, or we just can't quite make clear to us what someone is telling us. At that point, you should really go to an audiologist and have it checked out.
That's correct. It's a very, very gradual thing that comes up. So we're able to turn up the television. We're able to ask people to repeat things. And a lot of people that come into the office, even if they think they have hearing loss, they don't know to what extent they are experiencing it.
Okay. Well, that's certainly good to know. We're now going to meet some patients of advanced hearing health care. Welcome, Elliot. It's a pleasure to have you on our program.
I'm really glad to be here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, Elliot, I'd like to begin, if I may, by asking you if you can please tell us what brought you here to Advanced Hearing Healthcare.
I came here because I, over a period of time, began to realize that I was having some hearing loss. Could not hear in the restaurants during business conversations. Couldn't hear my students out in the field while we were teaching photography. It became a point where it was almost a disservice to the people around me because I had to keep asking for repeats of conversations because I just couldn't hear them.
Yes, indeed. That I can see how that clearly was affecting your life. You're talking about the quality of life, not being able to even hear folks, having to re-ask 2 or 3 times questions.
Yeah, it was a big problem, and you hit the key. It's a quality of life factor. Being able to hear the sounds around you and hear what people are saying and not missing anything is just incredible. You don't realize until you get your hearing checked that you may possibly have a problem.
So you had experienced this over a period of time where you started realizing that you were suffering from hearing loss.
Oh, absolutely. At first, and I was younger, I just put it off to the restaurant or the place where I was being too noisy, and that everybody was probably having the same problem. But the truth was they weren't having the same problem.
So then what happened when you came here to Advanced Hearing Healthcare? What took place?
When I came here, I explained my situation. They gave me the hearing exam, and it definitely showed that I was hearing impaired, and they recommended hearing aids for me, and I immediately said yes, because again the quality of life factor was very, very important to me, and they fitted me for the hearing aids, and here I am.
And how happy are you with the hearing aids?
Overjoyed, absolutely overjoyed. I'm hearing sounds that I haven't heard in years. I commented to my wife just last night. I never realized where we live, which is kind of like a bird sanctuary. Suddenly I was hearing all of these birds, which I haven't heard in a very long time. It was just incredible. So it really makes a big difference.
Well, I'm so happy to hear that, Elliot. You don't have to re-ask, what did you say anymore, I
That's
take
right.
it. Right?
That's correct.
And
I hear you perfectly.
That's great. And you know what? I'm looking at you and I don't even see you having the hearing aid in.
Oh, no, you can't tell. They made them so small today. They're so technically advanced. They're all computerized. It's stereo. It works off of Bluetooth. I can link directly into my iPad through a little device that normally hangs off my neck. So whatever sounds are on the iPad or on my phone, they go directly into the hearing aids. So they're very, very clear. And I'm about to buy a little Bluetooth device that goes near the television set. So it'll be even better.
Well, that's wonderful, Elliot. And lastly, before I let you go, for all the folks out there that are watching, what would you tell them about your experience here, not only with the doctors, but also the staff as well?
Oh, I go to a lot of doctors. I'm 70 years old, so I make my trips, on a normal basis. And I got to tell you, the care that they gave me here, the concerns that they had, everybody just took really good care of me. I'm impressed with their operation.
Well, that's great to hear. And on that note, I'd like to thank you, Elliot, for joining us, being a guest on our program.
Thank you for having me.
It was our pleasure. Willa, it's very nice to have you on our program as well.
Nice to be here.
I wanted to begin by asking you what problem or hearing problems were you experiencing, Willa, that brought you here to the folks at Advanced Hearing Healthcare?
Okay, I was at church and I could hear the minister, but I could not understand her. So I knew I had to get further help.
Oh my goodness, so it was to the point where you really couldn't hear folks too
No,
well?
I could hear them, but I couldn't understand what they were saying.
And how long were you experiencing that particular problem?
Probably several years.
And it just gotten worse over a period of time?
Yes, yes.
So then you realized you had to do something.
Right.
And at that point, what brought you here to Dr. Maria, Dr. Scott, and the folks at Advanced Hearing Healthcare?
First I had gone to 4 different audiologists, and their testing was so fast that I didn't feel comfortable with what the results were. And a friend said that she goes to Dr. Maria, and Dr. Maria was terrific. So I figured, okay, I'll come here. And within 5 minutes, I knew I wasn't going to go anywhere else.
That's very interesting.
Her
So
testing is much more thorough than the other 4 audiologists.
So, in other words, from what you just told us here, you had gone to 4 previous audiologists.
Yes.
They were very quick in their testing.
Yes.
You just didn't feel comfortable with what they were talking about and
No.
what they were looking to have done to correct this problem.
Correct.
And you came off a referral to Dr. Maria.
Yes.
And within 5 minutes, you just felt that this was the right doctor for you.
Yes, there was no question in my mind that, and it was so much further. I thought, my gosh, I'm going all this distance. But within 5 minutes, I figured, I don't care about the distance.
Yes, there's no distance to getting your hearing.
Right,
When
right.
you really think about it, right?
What makes her so unique is that you don't just see her once. You see her until she feels, and I feel, that the hearing aids are the best they can be. And that's what's different about most people. Because I have a friend, they very seldom see him more than once or twice.
They basically get you fitted and send you on your way and don't really follow up to see if making sure that that is the right match and you're able to hear. But here, it's different.
Oh, she's terrific. Absolutely terrific. So, oh yeah.
So then, can you please tell us, did you, a little bit about the hearing aid itself? Is it very small, you can't really see it, things along those lines?
Well, the one I had before was like that, but it got to the point where it maxed out.
Okay.
And because I have long hair, I was a little bit concerned about this one. And this is relatively new. I've only had them about 2 or 3 weeks.
Okay.
But you keep coming back to her until she gets it the way it needs to be.
Yes.
And that's what makes her unique.
Well, that's great to hear. And lastly, before I let you go, for the folks out there watching, what would you tell them about the staff here as well?
Oh, they're terrific. You know, you call to make an appointment and then, you know, I like coffee at the end because I'm a little bit nervous when I come in, not knowing what's going to be happening. And having coffee at the end just calms you down. And yeah, they're very friendly, very nice.
Well, that's great to hear. And again, we appreciate it, Willa, for you coming and joining us and being a guest and updating us about your experiences.
Okay, thank you.
Thank you. Charlene, it's a pleasure to have you on the program.
Thank you.
I wanted to begin by asking you the exact same question I just asked Willa and prior to her, Elliot, and that is, what problem or problems were you experiencing, Charlene, that brought you here to the folks?
I had a pair of hearing aids that I could not wear because they hurt. So I could have them in my ear for maybe an hour and that was it. I realized that I was quickly becoming a hermit. I was avoiding person-to-person contact because I was having trouble understanding people.
Sure.
I was extraordinarily frustrated with the audiologist that I was seeing at the time. So much so that I called the hearing aid manufacturer. And I said, who else can I go to? And they said, well, we don't really recommend, but you know, we have a list of people on our website. Went on the website and I found Dr. Maria, selected her only because she was close to my house. And I went over, I explained my problem, and it was comical because I sat down in a chair in front of her office. She got up from behind her desk and she walked around and she looked in my ear and she said, "Well, of course they hurt. They don't fit right. You have the wrong receiver length." I was like a deer in headlights.
My goodness.
So she fixed it, and I could then wear those hearing aids, for an extended period of time, and I, quickly became a little bit functional again. So it was fabulous.
So your quality of life obviously was affected prior to this correction.
Absolutely.
I'm sure it was affecting you as far as listening to folks, hearing them, maybe having to re-ask the question like Elliot mentioned earlier.
All the time. And what I did was I started to avoid people because of that, which is not healthy.
No. And you obviously experienced this loss over a period of time, I take it.
Yes.
You're getting progressively worse until you had it corrected.
Yes, although I will tell you that I think, wearing hearing aids, if you have a hearing loss, it can, I don't know that it prevents you from getting further hearing loss, but I think it can slow that process down.
Very interesting. And for the folks out there that are watching, what would you tell them about the doctors and the staff here?
Oh my gosh. Well, if you want quality service and if you want to go to an organization that treats you like a human being, like a member of the family, really, that has the proper selection of instruments that will properly or adequately serve your purposes, this is the place to go. Don't mess around with anything else, because Dr. Maria and Scott know how to program hearing aids, which is key. If you can't program them properly, they're worthless.
Yes, indeed. You got to make sure everything is in tune with that particular patient's needs.
And I think that's a talent. I really do think that's a talent, and they have it.
Well, I think that speaks volumes, no pun intended.
I was going to say.
Yes. And on that note, I'd like to thank you, Charlene, for joining us and being a guest on our program.
It's my pleasure.
It was our pleasure having you on.
Thank you.
Well done. We're now back with Dr. Maria. I must say, all three patients, you brought their lives back, the quality of their lives, not to mention how much they love you all. You really treat them like family here.
We do, and I think one of the most important things is to actually listen to them and what they need and what they are trying to tell us, because I think that being an audiologist, that's probably one of the most important things. That's the only way we can find a solution to the problem.
Yes, indeed. Now, we're literally out of time as far as our interview with you, Dr. Maria, but I wanted to ask you, before I let you go, you and your practice, Advanced Hearing Healthcare, I understand you have 2 locations in both Lorton as well as Arlington, Virginia, so you're very convenient for a lot of folks in the DC metro area. You have developed a reputation for excellence in hearing care, in patient care, and I just wanted to ask you, what would you say helps separate you and your practice apart from many of the others?
Well, thank you. One of the things we have in our practice is called DIAT, D-I-A-T. First of all, we're doctors of audiology, and between the two of us, we've had over 45 years of experience. We've seen over thousands of patients, and we've fit over thousands of hearing instruments. The second part is I, for inclusive. All of our services are inclusive, whether they come in for a programming or a hearing check or a hearing cleaning of some kind. We want people to feel comfortable enough to come back in so that we can make the appropriate adjustments so they're not out there putting their hearing aids in a drawer. And I think that that's very important. We also include batteries for our patients. Our staff is very accommodating. And one of the things we also do is for health insurance benefits, we will submit for the patient on their behalf too.
That's a very nice touch there.
Yes, yes. And the last thing, and a very important thing, is that we have advanced technology. And the advanced technology are leading manufacturers that we use. So you're not going to find these types of manufacturers in the big box stores that are out there. And you're going to have that quality of good hearing. We have an armamentarium of many different types of hearing instruments, and we're able to select what's best for the patient.
Well, on that note, I certainly would like to thank you for joining us, Dr. Maria, and being a guest. You certainly have educated us, enlightened us on the advances that have taken place in hearing care.
Thank you.
It was our pleasure. We'd love to have you back on in the future.
I'd love to be here.
Welcome, Dr. Scott. It's very nice to have you on our program as well.
Thank you. Thank you for having us in.
Dr. Scott, I wanted to begin by asking you if you can please tell us, how does an audiologist like yourself determine if a patient requires a hearing aid? And I guess the other part of that question would be if they're even actually suffering from hearing loss that would require them to have the hearing aid.
So when a new patient comes in, they'll come in and we'll, first thing we do is we sit down and go over case history. And we look at the patient's experience with hearing loss, if they've been diagnosed before. Is this maybe, are we looking to see if there's any hearing loss, what they've been experiencing, if they've been exposed to any noise or any other medical illnesses that could be related to a possible hearing loss. After that, we do what's called an audiogram. An audiogram is a test to see what you're hearing across the different frequency ranges, okay? So bassy tones to high-pitched tones, and where your individual problem is in finding out exactly what that testing is, okay, and how you respond to those beeps. The next part of the testing is we look at speech and how well the person can understand speech when we correct for their problem. So that way we understand, can get a good idea of how a patient will do with a hearing aid if they pursued that. So that we can look at expectations of what, here's our problem, here's how we can fix it, and this is the results that we can expect. And then we look at, we sit down with the patient afterwards, go over all of the results, and the selection process of a hearing aid is very personalized to the patient. We want to know how what different listening situations the patient's going to find themselves in an average week, and then we select the right technology to fit their lifestyle and their cosmetic needs and their ears, and that's how we go about getting it's a very interactive process, and it's a process that we like to think about it as doing it together. It's a group activity. Because we all have to arrive at the same place and be very happy about what technology we've selected.
Very interesting. It's a very thorough process as well from what you just described. But the end result is the hearing aid for the person who is suffering from hearing loss that is the best fit for that person.
Yes, exactly.
And speaking of fits, I just wanted to follow up by asking you, I take it based on what you just told us then that each hearing aid is custom fitted for each person.
Correct. So not only physically is the hearing aid custom fitted to the patient, whether it's the size of the actual instrument or if it's a custom shell or something like that, it's custom fitted physically, but then the more important part of it is the actual customization and the programming of the hearing aid. So that way that it can work for you when you're with your family in your dining room, or when you're in a meeting at work, or when you're playing cards or with your bridge club. It's meeting the needs of each patient and making sure that the hearing aid is going to maximize their ability in those different situations.
Well, that's certainly good for us to know, Doctor. I appreciate you telling us that. And I wanted to also ask you, Dr. Scott, are hearing aids adjusted over a period of time?
They are. As a patient grows with the hearing aid and gets used to the hearing aid, there's adjustments in the beginning as you get used to a hearing aid so that we can ease you into the use of a hearing aid. And then there's also adjustments 2 and 3 years down the road as your life changes. well, the hearing aid needs to change with your life so it can fit those different areas. And also, as the hearing loss, sometimes hearing loss can be progressive. A lot of the times it is. As we age, we get more and more hearing loss. We'll be testing, and we try to test our patients every year so that we make sure that we're always using the most up-to-date information to, again, personalize it to that person.
And speaking of down the road, how long does a hearing aid typically last?
Well, I would say that the national average right now for hearing aids is about every 3.6 years patients update their technology. It's usually not because the hearing aid is broken or not working. It's that technology is moving forward so quickly that the patients don't want to be left behind. They want to be able to maximize their ability, and more and more, or every single time with all of our patients, when patients get that taste of being able to hear again and realize that it doesn't have to be so difficult to hear, that it can be natural and easy like it was before, they just want to do better and better and better. And the technological advances that come along usually help people to do even better and even better and even better. So when they come in 4, 3, 4, 5 years later after purchasing their first or getting their first set, we'll always like to show patients what's available. We're not a pressured sales type of place. We're not going to be pressured into, oh, you have to upgrade every 5 years. It's about showing patients what's out there so that they have the choice of upgrading if they want to.
Yes, indeed, and I think that's the right approach, certainly, to take based on the patient's needs over a period of time. An example that a lot of people might relate to would be like the big screens, the televisions, right?
Mm-hmm.
The 50 is more than sufficient, but over a period of time, if a 60 or a 70-inch comes available and the prices drop and you can upgrade, there are a lot of people that do take advantage of those upgrades. I would take, based on what you just said, for something obviously far more important, which is our hearing, affecting our quality of life. It's good to know that there are options, there are advancements that keep coming through one's life, and they can pick and choose what they want to do with the next step.
Definitely.
And on that note, I'd like to thank you as well, Dr. Scott, for joining us and being a guest with us.
Thank you.
It's great having you on.